Hello everyone, I am Dr. Subramanian from Tirunelveli. I am a rheumatologist here. I am just trying to explain in this short video about rheumatoid arthritis, which is an inflammatory arthritis affecting the small joints of the hands and the feet and also other joints. So I am just trying to raise awareness and also about the disease and the medications. So basically it is an inflammatory arthritis which affects the small joints and the large joints, and usually in women of 30s and 40s, but it doesn't spare younger children and also old age people. It manifests with like painful joints, so people tend to have swollen fingers, knuckles, and also in the wrist and in ankle too, and sometimes toes can be a problem. And usually the pain gets worse with rest and better with activity, and there is something called early morning stiffness. The people tend to have stiff joints in the morning, so that suggests more of rheumatoid arthritis. It also affects the younger children, and their sports and physical activity can go down, and it also can have fever and other symptoms like breathlessness and cough if the arthritis is of rheumatoid variety, and it can go on to other parts of the body too. Although it is arthritis, it can affect every system, but commonly eyes, skin, lungs and kidneys are affected, and sometimes blood vessels can be affected too. How do we diagnose it? We tend to take a good history and examine the patient, and then do a few blood tests, which does involve inflammatory markers, ESR, CRP, and also kidney and liver function test. Sometimes we may need MRI scan too, or ultrasound of the hands to find out about inflammation in the joints. Those who have rheumatoid factor positive and also joints getting affected on both sides, they tend to have rheumatoid arthritis, but there are other varieties of arthritis too, which I will talk to you in another time. So apart from the blood test, we do scans as I alluded to earlier, and once we get to the diagnosis, then the treatment pathway starts. The treatment includes anti-inflammatories and steroids for a short period, and then there are medications called disease modifying drugs like methotrexate, sulfasalazine, leflunomide, which are commonly used in India. Apart from the tablets, there are injections called biologics or biosimilars, which are recently being used in our country. Although it is expensive, it does have a role to play in specific patients, and children also do better with these injections apart from the medicines. Once they take medicines, people tend to have regular follow-up with the rheumatologist, either monthly or once in 3 months, and their blood test things will be monitored regularly. And it is important that we tend to continue the consultation with the rheumatologist so that the whole health as a holistic concept can be maintained without much complications. As we know now, rheumatoid arthritis is like hypertension and diabetes, so it can be a risk factor to the heart, so they need to maintain adequate control of arthritis, thereby maintaining the health. If we don't treat it effectively, basically it does get the joints damaged, so people end up having osteoarthritis, which is the wear and tear type arthritis, and may need replacement of the joint even in younger age group, which does happen occasionally, but not anymore in future. And the treatment approach has changed in the recent years. After we have been using steroids and painkillers in the past, now we tend to use more disease modifying drugs and biosimilars recently. There is a concern that people having medicines and rheumatoid arthritis cannot get pregnant, or there are issues, but that has been proved time and again that if you have a safe pre-conception consultation, then there is no concern that the patient should get married, get pregnant, delivered, and also safe breastfeeding. Of course, we need to be informed prior, at least 4 months in advance, so that we can modify the medicines appropriately and support the patient. It does affect predominantly the female population, but male population also gets affected, and children and older age people are also getting affected. So generally patients tend to ask me, what type of food restriction do we need to have when patients have rheumatoid arthritis. Generally evidence-based doesn't support any restriction. Only for gouty arthritis, tend to avoid proteinaceous food and pulses and mutton, but there is not much beyond that. Patients generally feel that taking protein food gets worsened with the pain control, so I agree with them. In this part of the area, vitamin D is very low, so that improving vitamin D by exposure to sunlight or adequate vitamin D also helps in pain modulation, because after all vitamin D is important for musculoskeletal health. So apart from that, simple analgesic should do, and apart from this there is no specific food restriction. And the patients who are what we call as a remission, which means good control of the disease on medicines without any risk, any problems, they can continue their job, continue their life, and also family life too. So with that little note, I would like to conclude this, and if we have any more questions we can do another time. Thank you very much.